great to be in the studio today with a very special guest. I am, for the very first time, welcoming Joyce Fetrow, Project Director for the North Michigan Opioid Response Consortium. And this is an issue that is very, very heavy on the minds and hearts of hospital administrators, community leaders across the country. This is not just an issue restricted to Michigan or any of our respective states. It's an impact globally, even in issues that we face with opioids. And so today we're going to be talking about some of the programs. We're going to be talking about some of the initiatives and efforts done in this project, and I'm excited to learn more. So today, having Joyce in the studio is a welcomed guest for us, because we've never tackled this issue on our podcast in all of the years. We've danced around it a little bit, but really from someone who's leading this initiative for the state, it's exciting to have you here with us. So first of all, Joyce, welcome to the podcast for your very first time. That's great to have you. And second of all, why don't you tell our listeners a little bit about your role with the Michigan Center for Rural Health and the work that you do there, as well as, what brought you to that organization and why did you choose that particular field?
Right. Well, my involvement with Michigan Center for Rural Health started as a collaboration volunteer capacity back in 2018. And in 2018, I was notified by my current employer that there was going to be some collaborative work. We were going to start seeing some opioid grants coming down through HRSA. And she really encouraged me to start participating in these collaborative events. And so once every month, Michigan Center for Rural Health would come up to Grayling, Michigan, and they brought some staff with them, and we did some coordinated work with other key players in northern Michigan. So sectors from law enforcement and hospitals, healthcare, treatment centers, recovery community centers, anything that touched the lives of mental health or substance use disorder was involved in this planning process.
Wow.
And we started to lay out some groundwork. We were given some money. It was a planning grant through HRSA. So we were going to take some money from HRSA and start planning out a work plan that would last for 3 to 4 years. So what does that work plan look like? Where are we going to touch? Where are we going to spend this money? And as we got near to the end of this planning grant, John Barnes, who is now my supervisor, director,
By the way, John
said,
Barnes is a rock star.
he is. He most
He is
definitely
one of my
is.
most steady and favorite guest. You can't shake John up.
No.
I love his demeanor and the work
Yep.
he has done. I have to pause and just say the work he's done at Michigan Center is remarkable. We had the chance to interview. I think we got through about half of them across the country. Looking at from a state perspective, from state to state, centers for rural health, and we had an opportunity to interview, like I said, nearly half of them. And I'm going to tell you, John is definitely a leader when it comes to
Yeah.
centers for rural health, and he's done a great job. So that's a side note. We've had John on as a guest before on this program. It's great to have, to know that you're being mentored by him. So I interrupted
Yes.
that to give a special message, but back to you.
Yeah. Important message nonetheless.
Right.
But he came up to me during this collaborative planning process and said, if we get awarded implementation, it's going to mean that we're going to be creating some new staffing roles. And he had asked me to write the job description of someone who was highly involved in the recovery community, somebody who had maybe some credentials. I came to this collaboration with some lived experience with my own recovery from addiction. And that was why I was so passionate and highly involved in this planning process. And it took me a couple of weeks, but I presented him with the job description, and he notably pointed out that I pretty much wrote the job description for myself and
That's
then
incredible.
handed it to him. And I
That's
was
incredible.
currently employed
Yeah.
So he's like, I can't help but
Congratulations.
notice these are all of your experiences and credentials. And I'm like, well, if it works out like that, it works out like that. I just think that's the best person.
That's great.
And so I started with Michigan Center for Rural Health as a project associate. I had a great leader as a project director when at the beginning of this, and then she did things that most women do and start a family, and then found
Yep.
that maybe this role wasn't for her anymore, and we
Yeah.
greatly appreciated that, and we wished her the best. And then I slid into this role as project director.
Nice.
As I mentioned, why I got into this work is because of my own lived experience. And I had struggled for years with alcohol use disorder, and had found, recovery and wellness and sustainable recovery and wellness, and had just immersed myself in all things substance use related, substance use recovery related. I was in the process of opening a women's recovery home in Petoskey.
Oh my
I had a
goodness.
lot going on, but I wanted to take on this new role and start this new venture with the Michigan Center for Rural Health. So it's been 6 years that I've been in this role, and just love it every day. I'm sure you've heard the phrase, if you love what you do, you never have to work a day in your life. And I find that to be not entirely true. I think you work harder than ever for something that you greatly love.
Absolutely.
And
I like
you
that
give your
analogy.
blood, sweat, and tears.
Yeah, you're right. You're right. I often use that phrase, but never in that context. You're right.
Yeah.
It's what we give 100% of our all, which is pretty evident in what you have done and what you are doing, and which we're going to jump into in just a minute. Before we do that and really get into the meat of our discussion today, we have listeners across the country, as I shared earlier. We like to humanize our guest. They're not just talking heads. They're not just
Yeah.
bureaucrats. And so one of the questions that we find, very, very relaxing for not only our guests but our listeners is to ask the question of our guest, what is something most interesting about yourself, something you've done, a fun fact about you that can relate you to our listener? Could you share that with us?
I can. As I shared, I've been in recovery 4,489 days today.
Congrats.
I think the interesting thing is I don't count every single one of those days like that. I use an app. So
Oh,
I found an app that does that, instead of just sticking a penny in a jar.
exactly. Exactly.
Um, but I think, in my early years of addiction, I used to chase that neon rainbow, and my new passion is everything outside, everything nature. I still chase a neon rainbow, but it's the aurora borealis, or the northern lights. So it makes
That's
quite a
great.
few appearances in northern Michigan,
Yeah.
and I follow a bunch of different apps to catch its beauty. And I don't know if you're aware, but there was 2 times last year where anyone with a camera or a cell phone could have
Yes.
captured the aurora. It was so
Oh,
strong.
absolutely.
And I hate those days because I spend so much time and energy
Yeah,
chasing
trying to
that
find it. Yeah.
for the right opportunities. You can't have clouds, it can't have a full moon. You've got to have perfect conditions, and the strength has to be there.
Yeah.
So when everyone can capture it, those are my most disappointing moments, because
Yeah.
it takes away, I think, from the effort and
The
time that I
chase.
put into it.
Yeah. Very interesting fact. Very interesting. My wife and I travel every year up north, and she always is looking for the northern lights, as she calls them.
Yeah.
I've never seen them. She does. I can never see them, and I'm like, well, let me get my phone out. And I've taken pictures before where I can actually see
Yeah.
the northern lights on the phone. I guess it's not the same, but it works for me. But certainly in your line of work, what a great analogy.
Yeah.
And it's just to see the beauty of nature, and to chase after that is pretty incredible. And something that you're doing is also incredible, and that's opioid education awareness. Because this is something that is plaguing our country right now, and we're going to talk about that in just a minute. So, what today's focus is that we analyze, we look at the opioid use, and we look at what its continuation is, and its prevalence in rural communities, and in those communities lacking the resources to address it with sustainable solutions. And we find that in rural communities across this country. that this is an epidemic. We're talking about specific issues that are relative to almost every life, and every family is touched by this at some level. And so we're going to talk today a little bit about those strategies that can be deployed in rural communities. What can you do, to stay out there, that you're in an island and that there's no help is not the case today. There are resources available. And so Joyce is here to share her perspective as a leader in the field of opioid response. We'll talk about effective programming, prevention methods, and of course, what all this has to do with rural health. So first, let's talk a little bit about the specific work done. And let's talk about the North Michigan Opioid Response Consortium itself, how it fits into the Michigan Center for Rural Health, as the diagram would look, and what are your primary goals with this program? If you were to say today, that you've achieved nirvana, what does that look like, though? What are you trying to achieve with this? So take us through the journey, if you would, please.
Sure. Yes. So again, back when we started, we selected our first original 16 northern Michigan counties. Today we have grown to 25, and hopefully we will expand even further. But those 16 northern Michigan counties with that original work started because of some things that were identified. We look at a lot of data, we look at evidence-based information, but those 16 northern Michigan counties had high prevalence of overdose occurrences and overdose deaths. They also had a coinciding high prescribing patterns of opioids with our medical providers, due to not being totally informed that these products were highly addictive. That's where we came into play today with opioid settlement dollars. We did find out that they are highly addictive. They did create problems in our communities.
Yeah. Yeah.
But the other thing was some of those communities lacked a lot of resources across all sectors, prevention, treatment, and recovery. And that is what we aimed to do, was improve practices. So today, our work focuses across prevention, treatment, workforce, and recovery. Workforce is twofold. We identified a lot of behavioral health gaps, gaps in psychiatry, gaps with social workers, and just anything that would touch that. We started to look to improve those practices. But then we also found a lot of individuals like myself that had found and achieved long-term recovery. How do we use their new skill sets, get them trained? And today you'll see a lot of peer recovery coaches, individuals with lived experience of their own that have found sustainable wellness and recovery, who are now working in emergency rooms to help guide other people into recovery. We have them working in public safety departments. When there's a call with EMS, they're going out and responding to those calls. And instead of being someone of law enforcement, where individuals in recovery have found there just wasn't a good working relationship with law enforcement or healthcare professionals, maybe they were treated poorly in some of those instances, that peer recovery coach who is not dressed in a uniform, who's not wearing a white lab coat, can now talk to this person one-on-one and motivate them towards a level of wellness and recovery for their own.
Yeah.
We also have peer recovery coaches now working in health departments and treatment centers and detox centers and community centers, central hubs where people are showing up for food insecurity or housing insecurity. Sometimes those same individuals may have or may be suffering from some level of addiction. And so how can we guide them into that path of, yes, we can help you with your utility bills, but how do we move you forward and catapult you into a better future? So we're pairing them with peer recovery coaches or wellness coaches and getting them on track with whatever they need, social services, therapy, a connection to the community in a positive way versus how they maybe have been reacting before. So workforce is been hugely impacted, and we're still identifying, a few gaps and shortages. Things continue to change. We're looking at increasing capacity of providers here in Northern Michigan to expand medications for opiate use disorder. new residents in their practice, might be encouraged to go to Northern Michigan, but then they find out that Northern Michigan might not be for them because of the
Yeah.
weather that we
Yeah,
experience and
absolutely.
things like that. So it's kind of like, always turning over, and we're always chasing those things. But
Yeah.
we're really looking at some attraction and how we can keep them and make those practices more sustainable. But we also work across 50 different collaborating partners. And again, those are schools. We've implemented naloxone in schools. We've implemented naloxone, which is the life saving overdose reversal drug for opioids. Implemented that in libraries because we know our unhoused population sometimes go to the libraries to get warm, grab a cup of coffee, connect with friends, or job search on a computer. Just looking at different ways that we can improve practices for everyone. And, treatment expansion, access to treatment, there's always been a gap and a delay. If I found someone that wanted to go to treatment and get help for their addiction, we often find a week's wait time for them to get in.
Yeah.
We're trying to smooth that over with looking at other options for treatment centers, and transportation being another big barrier. How can we fix that? Well, we've partnered with a transportation organization in Traverse City that will
That's
help
incredible.
transport people to get them to
That's
treatment.
incredible.
And they have a peer recovery coach that rides in that car and
Wow.
keeps them engaged the entire way so
Is
that
that
they
right?
don't feel threatened or want to back out.
Wow. The work that you're doing is phenomenal. And it's
Yeah.
so, I mean, there's so many tentacles to this.
Yes.
The points that you bring up about social determinants of health and how that plays a role in substance abuse, food insecurities,
Yeah.
housing. We're starting to ask some of those questions at intake when we see patients at primary care. Do you have access to food? Are you able to pay your rent? And it sounds like, the work that you have engaged in here is addressing some of those social determinants of health because that's some of it stems from those issues that we
Right.
find. Let's transition a little bit and talk about communities that are impacted by opioids. And so I guess if you could identify, and maybe there are none, what makes a population, more at risk to opioid abuse? Or are all populations just at risk of it? And if there is that population that's more at risk, what are the long-term effects that substance abuse disorder have on those respective communities? So, are there communities that are at higher risk?
It's not just even opioids, but in addiction
Sure,
overall.
sure.
So, alcohol is a number one killer of all drugs or substances combined. What exists in communities is a lot of stigma. Stigma within the person who's suffering, and stigma within the families and the community that surround that person. Uh, there's a lot of stigma and willingness to seek treatment and get treatment. Often they've maybe hinted or presented themselves in an emergency room, but emergency rooms are not equipped to handle detox care or long-term substance use disorder care. So again, when an emergency room or a hospital or healthcare wants to get that person into treatment right away when they're ready, often we were met with barriers and gaps of accessibility within the treatment center itself. So uh, there's not one thing that I think makes communities more susceptible to substance use disorder or opiate use disorder. We've improved so many practices since 2018 when we first started
Yeah,
that there's very few things that still exist, but we're still working through each one of those bumps and hurdles. We've implemented, uh, like I said, peer recovery coaches in several different ways. We're increasing capacity of recovery housing so that they do have safe, stable recovery housing, regardless of what substance they use or misused.
mm-hmm.
Recovery community organizations, we're starting to see a growing trend of those popping up in our communities. So what we want to do is we know that there are going to be people that fall into a habitual addiction or something that is making them unwell.
Mm-hmm.
What are the positive things that we can do in that community to protect and give them a landing place to go to?
Mm-hmm.
And that's these recovery community organizations or
Mm-hmm.
recovery community centers where there's a group of people who are now living in wellness and recovery that can help, show that we do fun activities. We have sober bowling, which we do in the winter, and we have sled
Oh,
riding, and we have
wow,
euchre
that's cool.
tournaments, and we have
Yeah,
fishing tournaments, and we have rock bands where there's no substances involved.
nice.
And people can now engage back into those healthy activities with their families
Yeah,
and not have to worry about that. What I have seen in northern Michigan and across the state is that often there are festivals, and at those festivals and fairs, there's still
yeah,
the opportunity
there
for
is.
alcohol consumption. That no longer makes it 100% family friendly. But what can we do to work alongside that and have like a picnic in the park, or an aurora chasing night, or something like that? So we're always going to face those hurdles, but we need to provide those safe landing places for people where they can regroup and find wellness
Yeah,
again.
great work, great work. I mean, all of this comes at a cost. Obviously, time, effort, and energy, opportunity cost. There's also just the financial burden of transportation, arranging for
Mm.
events, facilitating events, hosting those events. Let's talk a little bit about funding in this area of substance abuse, specifically as we look at opioids. Where's the government at today with this? Is it a help from the state or the federal government? And I want to talk about not only the funding, if we could please, but let's talk about the regulation. What's going on in regulatory bodies throughout the country, whether it's a federal or state government, to address some of these issues. So let's start with funding. This does not come cheap. Where do those funding sources come from? What advocacy would you recommend so we can continue these great resources that you're offering in other communities throughout the country? And then what is the regulation looking like across the nation?
Yeah, funding comes at all levels these days. So we are federally funded through HRSA.
Okay.
There's
Okay.
another federal funder, and that's SAMHSA. The state is heavily involved in tracking this as well. So we have explored funding opportunities at the state level, and we continue to do that. We do everything that we can to even maintain our own sustainability, so that what we're doing just doesn't get lost in the mix when the funding ends. Like, what's our next step?
Right.
So we're always constantly moving, planning, and looking ahead to the future. And what we've never had before, which started just a few years ago, is funding at the county level. So, we had all the lawsuits with Big Pharma and
Yeah.
Purdue and Pfizer. All those dollars are now rolling in at the county level. And there's a process for reviewing those grant opportunities by just visiting your county website. So even at the most smallest level, you can find dollars to impact your own individual local community. You visit your county's website, you look at when that grant opportunity is open, and you look at the parameters and make sure that your activities or work plan fall within those parameters. And if you're stuck or you need assistance, there is another organization at the state level called Michigan Association of Counties. Amy Delinky spearheads that organization, and she is a great resource for not just helping people who want to apply for these grants and helping organizations who want to apply for these grants.
Yeah.
And does this fit within the parameters? But also she's advising and guiding at the county level who's never had to work with any of our prevention, treatment, recovery organizations before. That's never been in their wheelhouse. So you can imagine how they're like, if we do this, what are the repercussions for funding the wrong thing? Amy is a great resource and guide for being able to guide those counties into the right direction that's not going to have any adverse effects later in the future.
Yeah. As I'm taking copious notes here, it's a lot of work. And
It is.
let's have a conversation a little bit about advocacy, if we could. Do you spend any time in Lansing and Washington trying to educate our elected officials about these
I
significant
don't
deep problems?
specifically, but John does, and we do have a
Yeah,
lobbyist that
good.
advocates on our behalf.
Yeah.
As you know, with federal funds, you can't do that. We can't do that ourselves. So it
Right.
has to be
Right.
another additional
Entity
party.
that does it. And so, what would you say to
Hmm.
the CEO, the administrator across the country listening? What can they do to raise awareness? Where do they start? There are some communities today that do not have programs like this. We know that.
Right.
In fact, my community is limited. Where, if someone's listening today, where is the starting point? Could you help us understand that?
Yeah, I would rally the troops and find your key stakeholders within your community that work across all of those sectors: prevention, treatment, workforce
Yeah.
recovery. Conduct a community needs assessment. What are the needs of the community? I often hear individuals wanting to put recovery housing in the smallest community ever
Yeah.
that does not have adequate employment or transportation opportunities. And what we found with people with
Right.
lived experience is that they often have lost their operator's license or driver's license. So, equipping them with a vehicle isn't going to be as helpful. Sometimes there's no community bus transportation. But when you conduct a community needs assessment, you can determine whether recovery housing is going to be something that's going to be viable for that community.
Yeah.
And even if it's at the smallest level, is there a way that you can backfill that transportation part by maybe purchasing a vehicle under a grant and provide transportation at that recovery housing level? And that's certainly something that we see often. I'm in contact with recovery leaders that have started and implemented recovery housing, and they have had a car donated from a rental car agency that reached a certain number of miles, and they were
Hmm.
able to purchase it
Wow.
at a very low cost that made it equitable for them to continue that process.
Yeah.
So community needs assessment, find out who's interested in your community, find out what those gaps are, and then look to some of the other leaders and find out what they're doing in their communities that have made things successful. Implementation of peer recovery coaches, helping to move that needle from all the people that maybe do suffer from addiction. How do
Hmm.
we start to
Hmm.
encourage them? And
Hmm.
that has a ripple effect.
Hmm.
When you start seeing your friends and family find recovery, you're more inclined to also start to engage in some level of wellness and recovery. We've implemented practices within law enforcement where there's diversion programs for people that they come into contact with that they didn't necessarily connect or commit a crime,
Yeah.
so they're not going to jail, but it's maybe not safe to leave them in the home at that moment. What are some safe options for them? So they're connecting those individuals with
Hmm.
contacts and resources. Today in Michigan, anyone can surrender themselves to the Michigan State Police Post and get access to treatment that very same day. And a peer recovery coach is called in. They're called an angel. So there's the Michigan State Police Angel Program. That angel knows the process of navigating someone to get them authorized for treatment, and then they help transport them to treatment. So
Wow.
it's not just like one thing at a hospital or a healthcare or a clinic level. We've got law enforcement doing the same things at a different level of diverting people into treatment options or
Hmm.
sharing resources.
Hmm.
We have a program in some of there's a statewide organization called Face Addiction Now, and they have a program called Hope Not Handcuffs. It's a diversion program where they're working with, I believe, 128 police districts where they're diverting people to treatment versus a jail cell
Yeah.
and getting them access to treatment. And then when they return from that treatment process, again, they're paired with someone with
Hmm.
lived experience that can help
Hmm.
connect them to all the community resources where they're going to live or
Hmm.
work or
Yeah.
reside.
Yeah. A couple follow up questions before we conclude today. So those individuals that do find themselves incarcerated, so, they've had the fourth OUIL, they're really struggling, they've never really sought help, they get into the system. Many times we lose people in the system. Are there any
Mm-hmm.
efforts right now, whether it's local, state, or federal, are there any efforts to mandate any type of certain programming like this in peer recovery in our jails or institutions like that. Are you hearing of any of that, and what's the progress?
So there's a couple other things I'll share. At the court level, we have treatment court programs. We have treatment court programs for mental health people that have found themselves in the system because of mental health challenges. We have DUI or drug courts where people are giving support and access to treatment and recovery supportive resources to guide them through that program. We do have, again, peer recovery going into jails. We also have therapists and social workers going into jails and doing substance use disorder assessment. So even if they found themselves incarceration for a DUI and they're there for 3 days, maybe it's their second or their third, they're doing a needs assessment on that person or a risk assessment on do they meet criteria
Yeah,
to leave jail in lieu of going into a treatment provider,
right.
a residential treatment program. So there's even work being done within the jails. For opiate use disorder, we have quite a few of our jails now starting to offer or implement medications for opiate use disorder. So they're
Okay, they
implementing
are.
Suboxone or Sublocade at the
Suboxone.
jail
Yep.
level so that when they discharge, they are already stabilized in a recovery supportive program. All they need now is connection to resources and continue that program.
And so, as we conclude today, let's maybe I want to try to make sure I summarize this appropriately, so our listeners understand. Outside of all of the things you've identified, and you got really into the weeds, which was important, are there any other barriers that you're just frustrated with right now in the work that you're doing to getting this out there, to getting the information, the message? Are there any barriers at all in those areas? And maybe the barriers, maybe you just see community barriers as a barrier, like
Yeah.
specifically to communities. Could you share that with us a little bit if there's anything else? I know we've talked about a lot.
Yeah, despite some of the great work that we've done, we still have some organizations that will start the collaboration efforts, and then they start to fade off a little bit, and then those organizations go back to working within their silos, or we'll have new leadership changes that come in, and we kind of lose those contacts of what we've already built upon. That's probably one of the biggest ones is the turnover within the different infrastructures with the organizations we collaborate with. When there's change, it takes trust and buy-in to redevelop those relationships. So it's a
Yeah,
work in progress, and it's
absolutely.
just something that just continues to change.
We're going to put some contact information in our show notes so that if someone's listening today and they're looking at in their respective state starting something, obviously you have it not only off the ground, but this thing is flying high in the air. I want to commend you for the work that you've done. Obviously, your passion comes out, in the first 3 minutes of our conversation. It's evident, and I
Yeah.
think what's most important is you've lived it. And so you talk from a perspective of experience, which is unique to a lot of programs. And so I think that's a benefit. But we're going to put your contact information in our show notes so our listeners who may want to start a program in their respective state or community would have the access to reach out to you to say, all right, how do we start doing this? So we're going to do that. And it's always a pleasure to have an expert, on our podcast who can address some serious issues that our rural communities are facing, and not only address those, but also give us, some helpful hints, tips, and suggestions about how we can improve the quality of living in those rural communities. And you have done an exceptional job today explaining what you've done in those rural communities. And I look forward, to having you back again into the future to talk about some of the successes. We'd love to have a success story or two present with you, someone who has been through that program recently in our focus on opioid, but it can be substance abuse in general. Really, just to talk about what are the benefits of programming like that. So we hope to get you back here in the very near future to maybe tout some of those successes that you're seeing. And before we
Yeah.
close today, do you have a favorite success story? That's something that you've done
I
and worked on?
do. I think one of the things that we face the most is lack of trust with individuals who have found themselves in the criminal justice system against law enforcement. And there was a gentleman who was traveling 45 miles to Gaylord, Michigan from Roscommon to receive his medication. So he was traveling to a clinic where he has to report every single day just to get his medication to stay stabilized in his recovery. He was one of those individuals who has lost his license previously. He should not have been operating a vehicle, but that day he had to make a choice of either being very sick without his medication
Yeah.
or driving on
Right.
an expired license, revoked license. And lo and behold, he gets pulled over by law enforcement about midway. And he tells the officer, I know I shouldn't have drove, but if I don't get to Gaylord, I am going to be very sick. And if I'm very sick, I'm going to probably have to go to the ER, who's just going to maybe turn me away because there's nothing they can do for me but give me the medication that I need.
Yeah.
And he's like, I can't let you drive any further, but I'm going to take you there. And I
Wow.
need you to find someone else who's going to pick up this vehicle,
Wow.
and I'll get you to where you need to go.
Incredible.
And that is the success story where we built the relationships that these people are human. They are
Yeah.
still going to make mistakes, but they
Sure.
made that mistake out of survival and trying to stay
Absolutely.
engaged in their long-term recovery. And it just shows the work that we've done because, 6 years ago, 8 years ago,
Lock them up.
that person would have been
Lock them up.
in jail
Yep.
without his medication and most likely would have also have been terminated from the treatment program he was
Yeah.
being that he was in
Right.
for one having contact with law enforcement, violation of that treatment protocol, and then not being there for X amount of days. It just would have greatly impacted him. And again, like if he would have had to have gone to jail for that day, he probably would have lost his employment. He probably would have lost his children because he couldn't care for them. It would have had this major ripple effect, and one change with one officer changed that gentleman's life. And he shares that story so widely that I think it's starting to catch on with other law enforcement.
That's incredible. It's a heartwarming story, but it gets to the heart of the issue, and that is access and understanding. It could have been
Yeah.
very easy for that police officer just to quote unquote do their job, which
Yep.
was criminal act occurred. Let's put them in cuffs.
Yep.
And then they're done, right? There is no
Yeah.
transportation. There is no making sure they get a ride back. There's no worrying about transferring the car. The car is
Yeah.
towed. They go to jail. And it's incredible. That is the type of work that we need to do across this state, across this
Country.
country, to be able to
Yeah.
educate everyone to understand that they can be part of the solution to this and not compound the problem. And so, great work
Exactly.
to you and your team. I appreciate the efforts that you've put together for Michigan, and I can speak as a Michigander for that. And hopefully, we can allow this podcast to serve for each of those rural communities that may not have programs like this to serve as inspiration and maybe a kickstart to their own programming. So we'll put your notes, information in the show notes, so that way individuals can reach out to you. And before we close today, we always do a segment. It's called Rural Health Recommendations. And we have people that listen across the country, and some are new leaders. And if you're a new leader in healthcare today, it's quite a bit of a challenge. We have payer issues, we have government involvement issues, we have physician shortage areas, we've got major financial and workforce problems, and yet individuals are trying to find a way to still make it work in rural America. So you've been in the industry, you have real life experience. What piece of advice, sage advice, maybe some wisdom, would you give to a new leader today, or maybe it's a seasoned leader that's just struggling through today's times of all the tumultuous, times that are on their shoulder? What sage advice, what tip would you give them to continue doing what they're doing?
Well, I have to go with my passion here and speak about recovery. And what I know about recovery is when our communities invest in recovery, the ROI is $7 for every $1 they spend.
Wow.
And anytime that we can get that person into level of wellness and recovery, that person goes on to be a productive citizen in their community. They pay their taxes. They often go on to own their own homes, and they
Yeah.
vote.
Yeah.
And that is what a successful contributing person in every community probably strives to do.
Yeah.
And we need more focus on recovery components so that not only the individuals find recovery, but they raise their children in a life of wellness and recovery so that we can protect our youth more than anything, because that's where our future is.
Joyce, it's been great to have you. What sage advice that is. And may we just have others in communities across the country that are like Joyce, who are out there just spreading some great light into a very dark world and in a very dark subject. And so thank you for the work that you're doing, Joyce. Thanks for joining us on Rural Health today. It's been great to learn about the great things that are happening and to learn about your story and your journey. It makes it real. It humanizes it. And I want to thank you for being a guest today.
Thank you for the opportunity.
And thank you to our listeners for tuning into Rural Health today. Catch our next segment, Rural Health News, to stay up to date on the current state of rural health every Monday, wherever you get your podcast. Don't forget to check out our latest updates and resources from Rural Health Today at ruralhealthtoday.com, and make sure you subscribe so you never miss an episode. Until next time, remember, rural health strong.